Well, good morning. How's everybody doing? Good. It's 11 o'clock. It's time to start. However, we are missing about 4 people. So if it's okay with you all, I'd like to give them just a few extra minutes just in case they got stuck in traffic or lost or something. Okay? While we're waiting, you've all got a sheet in front of you right here. It looks like this is called the next step. It's just one of the loose leaf pages in your book there. I'd like to ask you to fill out the top section of that only. Just put your name, address, and phone number on it. And then if you're here as a couple, you only need to fill out one page. Just put both your names on that one page. And then once you do that, you will then become what I like to call a tax deduction. You see, the IRS will no longer accept just a receipt from the restaurant. They want to see something where an individual was actually here and ate the food that I'm paying for today. So if you do that, I'd appreciate it. We'll get started here in about 3 or 4 minutes. I won't keep you waiting long. All right, well, we'll go ahead and get started while she's getting your orders. Everybody's got a drink. Everybody's ready to go? All right. So my name's Ron Ray, and I am a financial advisor in the area. If you're not familiar with our firm, Turning 65 Solutions, we're just right down the road right here on Sonterra. So you go up Stone Oak, take a right on Sonterra, about 2 blocks down, and a big Microsoft building there on Ronald Reagan, right in front of the school and the hospital there. So we're just down the street or a phone call away if you ever need anything. Now, I'll tell you a little bit about myself before we get started. I'm going to try to keep up with these slides so I don't blow past too many of them. I've been in this financial services business for about 13 years now, and this is my second career, though. Before this, I've been a police officer for about 23 years. In fact, I just finally retired from the reserves last December, so I'm completely out of that. But a few years ago, I decided I wanted to get married and start a family and not have to wear a bulletproof vest to work every day, so I got out of that, and this is what I do now. Now, since I've been in this business, I pretty much only work with people like you who are turning 65 and going into Medicare, recently retired or getting ready to retire. And what that means is I don't work with people in their 20s and 30s and 40s. I just work with people like you. And that allows me to narrow my knowledge and my expertise to the things that matter to you. I don't have to know everything there is to know about insurance and finance. It's just what's important to you. So that's helpful too. Now, I don't know anything about you folks, except for the fact that the majority of you in the room are going to be turning 65 sometime in the next 6 months or so. So one of the questions that always comes up at these things is, Ron, how'd you get my information? And that's a fair question, and it's answered very simply. I bought it. You see, there's companies out there that compiled data from different sources like your driver's license or tax rolls or voter registration. If you ever filled out a warranty card for a new refrigerator, you ever wonder why you get through filling out your name and address, and then they start asking you questions about your income and your hobbies? Well, that doesn't have anything to do with the refrigerator. That's so that they can sell that information. If you've ever been on this thing called the internet, they know everything there is to know about you. And people like Mark Zuckerberg and Jeff Bezos, they all sell your data to people like me. I paid about 3.5 cents for your name and address. Now, I could have paid another penny and got your phone number, but I didn't do that because I'm not a telemarketer. I'm not going to bug you on the telephone. We just send you our little postcard and invite you down here to the restaurant, and we're glad you're here. But other than that, I don't know anything about you. So I was thinking to myself a while back, Ron, you're trying to get these people to come do business with you. You ought to get to know them a little bit. And I ran across one of these little things at HEB a while back. You ever seen one of these? It's some of the notable events that happened in the year you were born. I think most of you were born in 1956. So let's see what happened in 1956. Well, in world news, it was pretty quiet here. Let's see. Fidel Castro landed in Cuba and started a revolution. Grace Kelly married Prince Rainier. John Lennon got his first guitar. Let's see. Well, that's a lot better with that door closed. Let's see. In national news, Dwight Eisenhower was re-elected president. Let's see. Somebody robbed a Brinks truck in Boston. As the World Turns debuted on CBS.
It was on radio before.
I believe that is true. Yeah, but on television, well, it doesn't say television, it just says debuted on CBS. I'll take your word for it. In sports news, the New York Yankees won the World Series. The New York Giants won the Pro Football Championship. Dwight Eisenhower was the president. Who was the vice president? Who cares? Who really cares? It was actually Richard Nixon.
I was going to say that.
Well, it's okay. Nobody cares anyway. It's all right. All right. Life expectancy. Anybody want to guess at that one? Life expectancy in 1956? 60-something? Yep. 60-something is correct. 69.6 years. 69.6 years. So you're almost there. Cost of living, this is always fun. In 1956, a new house would have cost you about $11,000. Wow. The average annual income was about $4,500. A new car cost about $2,000. And a gallon of gasoline for that car. Anybody want to guess at that one? 27, 20 cents? 22 cents a gallon, yep. Yep. And those were real cars that burned real gasoline back then. And lots of it. Let's see. A gallon of milk was 97 cents and a pound of fresh hamburger meat was 56 cents a pound. If you were born in 1956, you share a birth year with some notable people. A few actors: Andy Garcia, Mel Gibson, Carrie Fisher, Bo Derek, boxer Sugar Ray Leonard, Kenny G, Joe Montana, the football player. Not to be confused with Joe Namath, who I know you're all familiar with. Right? I know Joe Namath. But he used to be a football player. You all know that, right? Okay. Any Jets fans in here? Okay. Because I might offend some of you later. All right. There. So now we know each other, right? So we get started. We got a couple of quick little disclaimers, though, before we do get started. The first one is that in a setting like this where I'm providing a meal, the law does not allow me to speak about specific insurance companies or plans or prices. So the only thing we're going to talk about today is just Medicare in general, which is the important part anyway. What does Medicare do for you, what it doesn't do for you, and what you can do to kind of fill some of those gaps. Okay? And the second one is I'm not making any of this stuff up. It all comes out of this book right here called Choosing a Medigap Plan. Now, this is an old copy that I carry around with me, but we're working out of the current version now. Now, the insurance companies used to print these things up by the crateful and send them to me, and at my seminars, I could hand everybody a copy. But they don't do that anymore. They're cutting costs too. So the way I get this to you now is I email it. So on your sheet that you filled out a while ago, there's a space for your email address. Write your email address down in that space, and then make a little note off to the side that says, please send me the Medigap book, and we'll email one of these to you tomorrow morning. Okay? But I'm not making it up. It all comes out of this book. The information in this book comes from the government, so we know that it can be trusted. You do have a book in front of you like this called Turn 65 Solutions. This is our guide for the presentation today. So all the slides, most of the slides, they're going to be up here on the screen for you, are in this book. This is yours to keep, so please take lots of notes, write down any questions that you want to ask me later. We've got a pretty full house today, so I'm not going to have time to answer a whole lot of questions. And I'm going to answer most of your questions anyway, just through the course of the presentation. But write them down, give us a call or an email tomorrow, and we'll get those questions answered for you. But these are yours to keep, so follow along. You've got another page, a loose leaf page stuck in there. It looks like this. These are some frequently asked questions. These are questions that you should be asking an agent. So if it hasn't happened yet, you're going to start getting a lot of phone calls. You may even have people show up at your doorstep. And there's still agents that do that. If you could be, working in your flower bed on a Sunday afternoon and some stranger will drive up and want to wish you a happy birthday. When that happens, pull out this page and start asking them these questions. Any agent that is ethical and reputable should be willing and able to answer these questions. There's no secrets in this business, or at least there shouldn't be. All right? So, last little thing, one question that comes up usually is, Ron, is this going to be a sales pitch? The short answer to that is no. There's nothing for sale here today. You can't even buy lunch unless you want to buy it for everybody. I'll let you do that. But what I want you to do is relax sit back and relax, take in the information, and learn. So that hopefully you'll get to know me, get to know my experience, my knowledge, and when the time comes, you'd want to do business with me. Is that fair enough? All right. So tell me, what happens when you turn about 64 and a half?
Get inundated with mail offers.
Start getting a lot of mail, right? When you turn 64 and a half, you pop up on everybody's radar, including mine. I sent you my postcard, and I'm glad you're here. But you're going to get mail from the government. Watch out. You might get your Medicare card in the mail. Be careful you don't throw that one away. You're going to get mail from Medicare supplement companies, Medicare prescription drug plans, Medicare Advantage plans, life insurance companies, funeral homes, annuity companies, IRA guys. They all know you've got your mind on certain things right now, and they all want your business. Okay? But you're 6 months away from your birthday, so what do you do with it? You say, I don't want to think about that for a while, so you do one of two things. You either throw it away, or you set it aside for later. You set it aside for later, and what starts to happen? It starts to pile up, doesn't it? But now you find yourself 2 or 3 months away from your birthday, and things are a little bit more urgent, because now not only are you getting the mail, but now you're getting a ton of phone calls, and other people are talking to you about it. So now your family members, your friends, your coworkers, they're all saying, well, did you get signed up for Medicare? You got to do this, you got to get this plan, or you're going to pay a penalty. So what do? You go home, you pull out that pile of mail, you start to go through it, and what is it? Yeah, it can be very confusing. It can be kind of a big mess. So my job today is to take that pile of mail that you're saving up, I'm going to sort it out into 4 separate piles. So we're going to talk about original Medicare from the government. We're going to talk about Medicare supplement plans, Medicare prescription drug plans, Part D, and Medicare Advantage plans, Part C. And my goal is, at the end of the day, you can go home, pull out that pile of mail, sort it out for yourself, and then throw at least half of it away. Does that sound good? All right. Now, what happens when you turn 65? You're now eligible for Medicare, right? Assuming that you qualify. Now, the way that you qualify is you have to have worked and paid into the Medicare system for at least 40 quarters. That's 40 quarters. Now, some people work their whole lives and never pay in. The most common would be some school teachers, sometimes policemen, firefighters, some other government employees don't pay in. Or maybe you just worked a job where you just didn't pay those kinds of taxes, like you were a homemaker or you worked overseas. You're not just out of luck. We can usually still get Medicare for you. So we can usually get it through a spouse's benefits, maybe even an ex-spouse or a deceased spouse. Okay? Or maybe you're just short a few quarters. Let's say you only work 32 quarters in the Medicare system. The government doesn't expect you to go back to work for 2 years just to get Medicare. They'll let you pay a little bit extra and get it that way. Okay? So you're not just out of luck. We just have to do a little bit of extra work on the front end. But for everybody else, you worked your 40 quarters, you paid into the system, and now it's time to get enrolled. And I did exactly what I said I wasn't going to do, and I skipped a bunch of slides. Okay. How to get enrolled. How do you get enrolled? Well, there's several ways to do that. And the first way is, if you're already drawing Social Security benefits, meaning you're already getting that Social Security check in your bank account every month, you are automatically enrolled in Medicare. You don't need to do anything. That's why I say watch your mailbox, because your Medicare card is just going to show up in your mailbox a couple of months before your birthday. And it comes in a very plain envelope, and a lot of people mistake that for junk mail and they throw it away. Okay, so a couple of months before your birthday, be sure you're watching your mail very closely, because you don't want to throw that thing away, because then you're trying to get a hold of them to get a new copy. Okay, that's if you're already on Social Security. If you're not on Social Security, well, you've got to enroll yourself. And there's a couple of ways to do that. Number one, you can drive yourself on down to the Social Security office. So, yeah, so that varies by location and time. Okay, so you cannot just walk into a Social Security office. You have to call and schedule an appointment. Okay. And there's two offices, at least two offices here in San Antonio. There's the one downtown, which is the one everybody knows about. There's another smaller one over on Isom Road, just down the street from here, right by the airport. That used to be a pretty well-kept secret where not a lot of people knew about it, and you could just run in and run out, and you didn't have to wait in line for hours, but the secret's out, and you have to wait in line for hours. Except now we're in the middle of a worldwide viral pandemic, and you can't walk in anywhere that the government has anything to do with. So you have to call ahead and schedule an appointment. So call ahead and schedule an appointment. Oops. Call ahead and schedule an appointment. And because they're not taking that walk-in traffic like they usually do, because most people that go to the Social Security office just show up. They don't have an appointment. We can't do that anymore. So now everybody has to call and schedule an appointment, which means an appointment time that used to be maybe about 2 to 4 weeks, which is, I think, reasonable, is now 6 or 8 weeks out. Maybe even more depending on the office that you're going to and how busy they are. So if you're going to go to the Social Security office, you must call ahead and schedule an appointment, and you must do that well in advance of any deadlines that you have. Okay? Option number 2 is what? To call them on the phone. You call the main Social Security switchboard number, and what happens? You get put on hold, right? For how long? A month? Did you say a month? It could be several hours. So folks, before COVID, depending on the day and the time of day that you called, you could wait on hold from 20 minutes to a couple of hours. Now, because all the offices are not open to the public, everybody that needs to transact something with Social Security has to call them. And so those hold times, again, depending on the day of the week and the time of the day that you call, can be several hours. Okay? We find that Friday morning seems to be the optimum time to call. Okay? So you might wait on hold an hour, maybe 2 hours. If it takes 4 hours, please don't get mad at me. I'm just giving an estimate. Now they do have this feature now where you can punch in your phone number and go about your business, and when you get to the front of the line, they'll call you back. Just make sure that you're ready to take that call, because if you miss it, you have to start all over again. Okay? That's option number 2. Option number 3 is what?
Online.
To go online, yes, to the Social Security website and enroll yourself. Folks, that's very easy. It takes about 5 minutes. In fact, we help people do that in my office every week. We just sit down at Erica's computer or my computer, we punch in your information, and you're done. It's very simple, and we're happy to help you with that. Okay? So, now you're enrolled in Medicare.
How soon before you turn 65 can you do that?
They will open that up to you 3 months before your birthday month. Okay? And because of everything, and it's the government, you need to give them all the time they need. Good question. All right. So now you got enrolled in Medicare. What does that get you? If you'll turn the page to that second page in your book. This is always kind of hard because these screens are so high, but we're going to be working on this side of the chart right now. That gets you Medicare Part A and Medicare Part B up at the top of this side of the chart. Medicare Part A and Medicare Part B. Now, Medicare Part A is your hospital insurance. It pays a portion of your hospital room and board and hospital services. Now, Medicare Part A, you have already paid for with your payroll deductions all your working life. So there's no further charge for Medicare Part A. You also get Medicare Part B. Now, Medicare Part B is your medical insurance. It pays a portion of your doctor bills, your office visits and outpatient services outside the hospital. Some doctors inside the hospital, if they're contractors, they don't work they don't work for the hospital. They're not employees of the hospital, not hospitalists. Okay. Now, Medicare Part B, you have not yet paid for. So now when you enroll, you're going to be billed $148.50 a month. $148.50. Now, if you're already on Social Security, they're just going to hold that amount right out of your check. But if you're not on Social Security, they're going to send you a bill in the mail. And that bill's a quarterly bill. It's for 3 months at a time, so it's a big number, close to $500. But once you get that first quarterly bill, there's a phone number on the back of it you can call, and they will help you set that up on an automatic monthly bank draft out of your checking account so that you can just pay it automatically for a monthly for a smaller amount instead of you having to remember to send them a big check every 3 months. Okay, so I recommend you do that too. Now, that's what you get, Medicare Part A and Medicare Part B. Once you have Medicare Part A and B, now you have two options, two separate routes for how you obtain your services. It's two separate routes. You can't have both. And once you make that decision, depending on a couple of different factors, you might not be able to go back. So it's very important that you make a wise, well-informed decision now when you've got the opportunity. Okay? It's two separate routes. We're going to talk about them separately today. And the first one we're going to talk about is the original Medicare route. Okay? And the first thing we need to know about is what does original Medicare actually do for us? So if you turn a page, you'll come to this one. Now, if you have original Medicare and nothing else, so I'm not talking about any kind of supplement or advantage plan or employer plan or retirement plan, just Medicare, A and B. And you go into the hospital for 1 day, up to 60 days, we're in that top green column that goes all the way across, right by the big number 1, days 1 through 60. You will pay a $1,484 deductible. $1,484 out of your pocket for the hospital. That's the Part A deductible, Medicare Part A deductible. But I want you to be careful with that one, folks. That's not an annual deductible. That is per eligibility period. Here's how an eligibility period works. It's 60 days. And the clock starts ticking when you leave the hospital. So let's say you go into the hospital on day 1. Well, you just paid $1,484 out of your pocket. And you're in the hospital, say, for example, 10 days. Well, that $1,484 covers your share of the hospital bill for those 10 days. But when you leave the hospital on that 10th day, the clock now starts ticking on your Medicare eligibility period of 60 days. So if you go back into the hospital on that 61st day or after, guess what? You pay that $1,484 again. So that is not an annual deductible, that is per eligibility period, and you can pay that several times per year. Okay. But that does cover 60 days in the hospital, so it's not a bad deal if you think about it, I guess. $1,400, 60 days in the hospital, not too bad. If you need to be in the hospital for more than 60 days, now you fall down to the next green line, and for days 61 to 90, now you're going to pay $371 per day copay out of your pocket for every day that you're in the hospital. $371 per day out of your pocket for days 61 to 90. Now at day 90, your Medicare benefits technically end. But now you've got what's called your 60 lifetime reserve days. They're in that yellow line by number 2. They're called lifetime reserve days because you only get them once in your lifetime, and once you use them, you don't get them back. And when you're in your 60 lifetime reserve days, now you're going to pay $742 per day copay for every day that you're in the hospital. $742 per day out of your pocket for days 91 to 150. And now at day 151, you fall down to number 3 in the red line. You are out of benefits. Medicare doesn't pay another penny. You are on your own. Until you leave the hospital, you stay out for 60 consecutive days, and it starts all over again. Except now you've used up your 60 lifetime reserve days, so when you get to day 91, you fall back down in the red. Okay? Now, if you find yourself down there in the red line, something pretty bad has happened to you, something pretty catastrophic. We don't see a lot of folks down there, although it does happen from time to time. Most folks are going to be up in that top line, paying $1,484. Worst case scenario for a lot of people, is they will pay that, excuse me, that $14.84 2 or 3 times a year. But that's just the hospital bill. But what do we know about these things? We get home from the hospital, we get the hospital bill in the mail. What follows shortly after that? The doctor bills, right? You're going to get a bill from your surgeon, from the anesthesiologist, from the radiologist. Yep. Pretty much anybody that walked past your door slow enough to whip their initials on your chart is likely to send you a bill. In fact, that person doesn't even need to be in the same city anymore. We find this with radiologists. I get a lot of calls, hey, how come I got a bill from this radiologist in Houston? Montana. Yeah.
They're all in Montana.
It's because, guess what they do now? They email x-rays. And the radiologist reads them, emails them a report back. So you don't even have to see that doctor to get a bill from them. But the good news is those bills are covered under Medicare Part B. Also covers office visits and all your outpatient services. Now, Medicare Part B is pretty cut and dry. First of all, you pay $148.50 a month. After that, there's a $203 deductible. That's once a year, $203. After you've met the $203 deductible, it's just an 80-20 split, right down the line. Medicare pays 80%, you pay 20%. With no maximum, though. So the plans you're used to up until now have a out-of-pocket maximum. Sometimes it's called a stop-loss amount, somewhere around $10,000 or $15,000 for most plans. With original Medicare, there is no limit to the amount of money that you can pay out of your pocket. If your bill's $3 million, you're just going to pay 20% of $3 million. Okay? Now, it's pretty black and white. $148 a month, $203 a year, 20% after that. But now there's a few different types of doctors we need to talk about. And the first one of those is a doctor who doesn't take Medicare. We don't need to worry about those too much because you're just not going to see them. Unless that's your doctor now, you need to figure out what's going to happen when you turn 65. They're going to tell you one of two things. Either, yes, you can stay with me because you're an established patient. I'm just not taking any new Medicare patients. Or they're going to tell you, I'm sorry, I don't do Medicare at all. I know you've been with me for 20 years. It was nice knowing you. Here's a referral for the doc down the street. That doesn't happen as often. We hear that story once or twice a year. Usually they'll let you stay on because you're established. Okay? So that's a doctor who doesn't take Medicare. The other two, though, we do need to think about. And the first one of those is a doctor who accepts Medicare assignment. Now, a doctor who accepts Medicare assignment has an agreement with Medicare that says that they are just going to take the Medicare approved amount, 80% from Medicare, 20% from you. And if there's any excess, that excess is just written off. You don't get billed for it. Now, you all know what the excess is, right? You've seen your EOBs from the insurance company, explanation of benefits. It's this real scary document. It looks like a bill, but it's really not. It's just an explanation. It shows what the doctor billed, which is this really high number, what the insurance company approved, which is an equally ridiculous low number, and the difference between those two is called the excess charge. Okay? If that doctor accepts Medicare assignment, the excess amount just goes away. They accept what Medicare pays, along with your 20%, as payment in full. Okay? They don't bill you anything else. That's a doctor who accepts Medicare assignment. The last one is a doctor who does not accept Medicare assignment. That doctor does not have that agreement with Medicare, so they take the 80% from Medicare, they take the 20% from you, and if there's any excess, they're now allowed to bill you an additional 15% above the Medicare approved amount. That's called the Part B excess charge. So here's a quick example of how that works. Let's say you go to your doctor, and your doctor sends you down the street for a little day surgery. Nothing major. It's the kind of thing where you show up at 6 a.m., you have your surgery, and you're home by lunchtime. Right? That's outpatient. You're not spending the night in the hospital. Most cases, you're not even going to the hospital. You're going to a little surgical clinic. Okay? That's covered under Medicare Part B. Okay? Now, you go and you have your surgery, successful, you get home, and the clinic sends the bill up to Medicare for $12,000. Medicare says, yes, that procedure is approved. However, it's only approved for $10,000. Well, Medicare will immediately pay their share of the bill, 80%, $8,000. You'll pay your share of the bill, 20%, $2,000, for a total of $10,000, a Medicare approved amount. But that leaves us with a $2,000 excess, doesn't it? They billed 12, they got paid 10. Well, if that clinic accepts Medicare assignment, the $2,000 excess just goes away. You never hear about it again. But if they do not accept Medicare assignment, they are now allowed to send you an additional bill for another 15% above the Medicare approved amount, which in this example was $10,000. It's the approved amount, not the excess. Okay? So you paid $2,000 here. Now you're going to get a bill for an additional $1,500 here. So that's a big difference. So it's important to ask those questions. Not only do you take Medicare and can I stay with you, but do you accept Medicare assignment or not? So can we agree that with Medicare alone and nothing else, you have a significant out-of-pocket risk? Is that a fair statement? Yeah. So what do we do to protect ourselves from that risk? That's right. We get ourselves a Medicare supplement. So if you'll turn the page. What's the first thing you notice about Medicare supplement plans? Yeah, they cost money. That's for sure. If you just start at the top and go down, first thing I want you to notice is that we are comparing apples to apples. So these plans are standardized by both the state and the federal governments. If that's a Medicare salesman, tell him you already got a guy. These plans are standardized by both the state and the federal governments as to the benefits that they provide. So that means that a Plan G from Company 1 is identical in benefits to a Plan G from Company 2, which is identical in benefits to a Plan G from Company 3 and on down the line. The difference is in the price you pay for it. Those are not the real numbers. It's just an example. And the service that you get from the company, which in most cases is me, Erica. You need something, you just call us and we take care of it for you. Okay? Now here's how they work. It's a little bit different from the insurance you're used to. A Medicare supplement's only job is to pay your share of the Medicare bill. Okay? And Medicare sets the prices. And by prices, I mean what they pay the doctors. Okay? So what's 20% of $100? $20, right? And it doesn't matter what city you're in, what insurance company you have, who your doctor is. 20%, which is what the plan pays for you because that's your share, is $20. So we don't have to have contracts with doctors, right? We don't have to have negotiated rates with doctors. We don't have doctor networks, which means that you can go to any hospital or any doctor that you choose as long as they accept original Medicare. That's the only requirement because Medicare has to pay first. Okay? Now, Plan G, for most of you, is the most comprehensive. If you're new to Medicare, that's the most comprehensive plan that you can get. It's the one that covers the most. And it covers everything except for that $203 deductible. So that does come out of your pocket. But once you've met that $203 deductible, which I'm going to go out on a limb and say that's quite a bit lower than your deductible now, what's the rest of your responsibility for the year? You go to your family doctor, what's your copay there? You go to specialist, what's your copay there? You go to the hospital, what's your co-insurance, your deductible? Nothing. You go for MRI, CAT scan, x-ray, blood work, lab work, ambulance rides, emergency room visits, urgent care centers. What's coming out of your pocket?
Unless you see a specialist.
Zero, as long as you've met the 203. Now that $203, folks, in medical terms, that's not a lot of money. Okay, so that is your first office visit will usually cover that, especially if you're doing blood work or something. And then for the rest of the year, you're done. You don't pay a penny. Okay. Now, because you can go to any doctor in any hospital you want to, there's no networks. You all know what a network is, right? Okay, it's a list of doctors that your insurance company allows you to go to. So if you have a network type plan now, like an HMO or PPO, you have to go to their doctors. Right? And HMOs can be very strict that you can only go to their doctors. If you go anywhere else, you're just on your own. They're not paying a penny. PPOs are more open. They'll let you to go to doctors that aren't on the list, but what do? You pay more. You pay the out-of-network cost, which is 2 or 3 times the in-network cost, right? And with Medicare Supplements, you can go anywhere you want to, right? And because we don't have doctor networks, we're also not limited to this geographic service area where you have to live and obtain your services. So if you have a network type plan now, like an HMO or a PPO, you have to live in and obtain your services in the service area. And if you move or travel out of the area, well, your insurance might not work. Okay? But these plans go where you go. They work exactly the same here in San Antonio as they do in New Braunfels, as they do in Houston at MD Anderson Hospital. If you need to go there for cancer treatment, if you go on vacation in Colorado or Florida, they go where you go. And it works exactly the same everywhere you go. Okay? It doesn't work the same out of the country, but some of these plans do have foreign travel coverage. Okay, because Medicare doesn't go outside of the country. But the F, the G, the N, a couple others do have foreign travel coverage. Yep, good question. Okay, so something else that we do not have with Medicare Supplements is something called managed care. Now what that means to you is what the doctor orders is what you get, with very few exceptions. Okay. So if you have a managed care type plan now, like an HMO or a PPO, and you need something that's not a regular office visit or an emergency, what do you have to do first? You have to get pre-approval, right? You have to get pre-authorization, and the insurance company can say no. Now, they're not going to say, no, you can't have that treatment. They're going to say, no, we're not going to pay for it, which means what to you? For most of us. It means you can't have it because you can't afford it. That's why you have insurance, right? But with Medicare and Medicare Supplements, everything pretty much that's medically necessary is pre-approved ahead of time in a book in black and white on the doctor's desk called the Schedule of Medicare Approved Procedures. And if the doctor wants to know if something's approved, he doesn't have to call the insurance company and wait for 2 weeks to get an answer. Just goes and looks it up in the book. Well, he probably Googles it, but you get the idea, right? Okay. Now, one question that always comes up is, Ron, if it's apples to apples, well, why would I want to pay more? And that's a fair question, and that's answered simply, you don't. Under normal circumstances, you want to go with the cheapest, good A-rated company. Now, there may be some B-rated companies or some companies that are very new to the Medicare market. And by cheaper, I mean a little bit, a few bucks a month, not a lot of money. But those companies are B-rated for a reason, so we try to avoid those. So as long as it's a good A-rated company that's got a good long track record in the business where we can see their history and what they've done, then that's usually what we're going to recommend. But here's what you need to know about that. Right now, when you're turning 65, you've got this window of opportunity from 6 months before your birthday month to 6 months after your birthday month, 6 months after your birthday, when you can get a new Medicare supplement with no health questions asked. No health questions. They don't care. As long as your check clears the bank, you've got it. But once you pass that 6th month past your birthday, if you want to get a new plan or change companies or change plans, you're now subject to medical underwriting. You have to answer a series of health questions, and based on your answers to those questions, you can be declined. So it's very important that you make a wise, well-informed decision now when you've got the opportunity. So what happens when you come to see me or you come to see Erica is we're going to sit down and we're going to have a good long talk about your health. And if we feel that you're healthy now and you're going to be healthy for a few years and you can be expected to answer those health questions favorably, well, we're going to recommend you go with the cheapest, good A-rated company. But one thing that we know is that all of these prices, they all go up over time. Now, some of these companies that start out very low in the beginning, they're just kind of lowballing you when you're young and healthy to get your business. They have a tendency to raise their rates a little more quickly than companies that start out a little bit higher have a tendency to raise their rates a little more slowly. So eventually this one is going to cost more than this one. Now, if you're healthy and it goes up too much for you, hey, no problem, we'll just go shopping and find you a cheaper one. But if you're not healthy, you might be stuck with it. So if you come to see Erica and she feels out you're not healthy now and you won't be able to answer those health questions in a few years, well, she might recommend that you start off somewhere over here. Because eventually, this one is going to pass that one. And folks, that happens quickly nowadays. When I first started doing this, it almost never made sense to go with one of these companies over here, because these companies didn't go up fast enough to catch them in 10 years. But we saw rate increases last year of 20% or more in 1 year from some of these companies on this end. Okay? And that was before COVID. That was with just the one little change that Medicare made. This year, we're going to start seeing those COVID increases. And I have no idea what those are going to look like. Now, I don't want to scare you. Please don't take that the wrong way. I'm just saying, we're not looking at what's the cheapest today, although that's important. We're looking at what's going to be the best for you several years down the road. Does that make sense? Yep. Did you have a question?
The 203 deductible, that deductible applies regardless to whichever plan you select?
If it's a Plan G, yes.
And is that 203 deductible, is that what's for 2021 right now?
Yes. Yes, and that does change. Every year it can go up. It's been known to go down, but I wouldn't count on it for a while going down. And Medicare sets that price, not the insurance companies. Yep. Good question. All right. That's Medicare Supplements. Anything else on those? All right. So one thing that Medicare Supplements nor original Medicare cover would be prescription drugs. So if you'll turn a couple of pages, you'll come to this one. Prescription drugs are covered under a separate program called Medicare Part D. Folks, it's real easy to remember. Medicare Part D, D for drugs. Now, I don't think that Congress intended it that way, but it worked out. Okay? Now, here's what you need to know about Medicare Part D. First thing you need to know is it is optional. You do not have to take it. However, if you don't take it when you're first eligible and you don't already have drug coverage through another source like an employer plan or the VA or TRICARE, something like that, then later on down the road when you do enroll, because now you need it, you will be assessed a penalty. It's called a late enrollment penalty, and it adds up. The later you are, the bigger the penalty is. And you don't pay that penalty one time, you pay it every month for the rest of your life. So what I always tell people on this is even if you don't take any prescriptions, just go ahead and get the cheapest one. It's less than $10 a month this year. And that does two things for you. Number one, it gives you some coverage in case something comes up, because you can't get these in the middle of the year. You have to wait for the annual enrollment period. You know, past that turning 65, right? And number two, it prevents you from paying that penalty later on, okay? So, those Medicare telemarketers are terrible. They're just calling everybody.
Yeah.
They know you're talking about it. Me? I'm jealous? Oh, gotcha. Yeah, so here's how these work. There's a whole bunch of them. And we don't know which one is right for anybody until you do one very simple thing. You bring us your list of prescriptions. And what we do with that is we plug that into the Medicare website. And it's anonymous. We don't put your name in, but we put your prescriptions in. And what that website does is it takes all these plans that are available out of your pocket for the whole year. And then because all the pharmacies pretty much take all of these, we just pick the cheapest one. Now we have to do that every year. Unlike Medicare Supplements that never change except for the price, these plans can change drastically every single year. Everything about them can change. The premiums, the deductibles, the copays, the formularies. Your prescriptions can change. The doctor can put you on something different. And you can only change plans once a year during the annual enrollment period from October 15th to December 7th. And then once that December 7th deadline expires, you're stuck with whatever you've got for the whole next year. So here's what happens. You get one when you turn 65, and then that very next October, we're going to call you and say it's time to review your drug plan. And let's say, I don't know, for example, you got this in August, right? And you started it in August, and Erica gives you a call in October, and you tell her, Erica, I just started with this thing. I don't want to be changing it already. Well, what you didn't know, and what we didn't know either, because there's over 30 of these things, and each one of them's got a formulary book with 1,500 drugs in it. We can't keep track of all that. Is that company that you had, and that with that drug that you were taking, that was on tier 2, and you were paying $42 a month for it? Those aren't the real numbers, by the way. Those are just made up. That company came back and said, we weren't making a lot of profit on that drug at $42. So next year, we're going to move it to tier 3, and you're going to pay $91 a month for it. Well, guess what? Company number 2 over here, they didn't make that change. They still have that drug at tier 2 at the lower price. But now you've let that December 7th deadline expire. You're stuck with that plan for the whole next year, paying $91. Whereas if you would have just come in and let us reevaluate it for you, we could have changed that for you and kept you at the lower price. That make sense? Okay, so that's what we do for you. Now, finding the right one's the tricky part. Once you've got it, they work pretty similarly to what you've got now. So you pay a monthly premium. We don't know what that is until we do the evaluation and pick a plan. After you've paid the premium, there's now a deductible, which can be as low as $0 on some plans or as high as $445 this year. After you've met the deductible, which may be $0, you just pay a copay when you go to the pharmacy. Now, your generic drugs are going to be very inexpensive. In fact, a lot of them are going to be free. And as you go up the tiers, though, they get pretty pricey. In fact, they can be downright expensive. So it's very important that we make a good decision here. Please don't just sign up for the first one that shows up in your mailbox with a $0 deductible. Okay? Because if they're not getting it at the deductible, where do you think they're getting it? They're getting it at the pharmacy. Okay, so nothing free. All right. Any questions on Part D? Okay, good. So we've covered the whole original Medicare side of the chart. We talked about original Medicare A and B, Medicare supplement plans that pay your out-of-pocket cost, and prescription drug plans to help out with the prescriptions. That's the side that gives you all the choices. So you can go to any doctor, any hospital that you choose, as long as they accept original Medicare. And when you go, there's no out-of-pocket virtually, because between Medicare and your supplement, they're paying for everything. And there's no managed care, so what the doctor orders is what you get, with very few exceptions. Now, your other choice is Medicare Advantage. Okay? So what happens here, this is also called Medicare Part C. What happens here is you continue to pay the $148 a month for Medicare. Okay? Now, you may be seeing some commercials right now that say that you're going to get that $148 back. We don't have those plans here. Okay, that's like one county in Florida that has a full payback on Medicare Part B. We have a couple of plans that do rebate some of the Medicare Part B premium, but it's like $50. Okay, so don't get excited that you're going to get all your money back, because you're not. There's another way to do that. Another thing that makes those commercials true is if your income is very, very low, you can get on Medicaid, and in that case, the state of Texas will pay your Part B premium for you, and then you'll get it back on your Social Security check. Make sense? Okay. But for almost everybody else, you're going to keep paying the $148. That does not go away. But what happens now is Medicare sends that money over to this private insurance company that you choose, and they combine your coverage and administer your health care for you, taking Medicare out of the picture. Okay? Medicare says, here's the money, you take care of them. Now, I want to be very clear on one point. You do not lose Medicare. You're still in the system. But what's happened is for that calendar year, you've been contracted out to this insurance company on this side. Okay? You've been contracted out to the insurance company. And you play by their rules. These are the HMOs and the PPOs. Yep. So what's the first thing you notice about Medicare Advantage plans? We are no longer comparing apples to apples, are we? No. Every plan from every company can be completely different. Now, the Advantage is that in addition to the $148.50 a month that you are going to continue to pay in most cases, you may pay little or no additional premium for your plan. Quite a few of the HMOs still have a 0 monthly premium. They are not free. In fact, it is illegal for anybody to tell you that they are free because you're paying $148 a month for it. Okay? PPOs almost all cost money. In fact, some of them can be pretty expensive. They can cost as much or more than a Medicare supplement, so you have to be careful there. Okay? Where you will pay is when you go to the doctor. So now you have out-of-pocket costs. You have co-pays and deductibles and co-insurance. Some of the HMOs that we have around here still have a 0 copay for the family doctor, but go to the specialist, you're definitely paying a copay there. Go to the hospital or outpatient clinic, you're paying a copay there, or co-insurance. Ambulance rides, emergency room visits, urgent care centers, MRIs, CAT scans, blood work, lab work, you're paying a portion of all those bills out of your pocket. Okay. Now remember, Medicare's out. They said, here's the money, you take care of them. Now who gets to set the prices that they pay the doctors? The insurance companies do. So now what's 20% of $100? It ain't $20 anymore. It's more like $18, $12, $10, $8. Some doctors may not be willing to work for that amount of money. So now we're back to doctor networks, right? We have to have contracts and negotiated rates with doctors, which means you have to go to their doctors. Now, HMOs are very strict. You can only go to their doctors. PPOs, again, are more open. They'll let you go to doctors that aren't in the network, but you pay the higher out-of-network cost. Okay? And because we have doctor networks, we also have service areas. You have to live in and obtain your services in the service area. If you move or travel out of the area, it's a better than average chance that your insurance might not work. Now, you'd probably be okay in emergency, but if you need something that's not a life and death emergency, you could have problems, especially with an HMO. And some HMO service areas may be very small, may only cover 1 or 2 counties around where you live. For anything that's not a life and death emergency or just a regular office visit, you have to get permission from the insurance company first, and the insurance company can say no. Or they can put you on step therapy, which goes like this. We're not going to pay for that treatment yet. We want you to try this other cheaper treatment first, and if that doesn't work, then we'll pay for that one. Which does what for you? Prolongs your treatment, prolongs your illness. If the doctor wanted you to have that treatment, he would have ordered it. So now who's in charge of your healthcare decisions? You and your doctors? Or the insurance companies? Right? Now, that's all the bad parts of it. I like to start with the bad news first. Here's the good news. These plans have gotten much better over the last few years. I used to not like them at all. I refused to help anybody sign up for them. Over the last, I'd say 3 or 4 years, they've gotten much better. The doctor networks are bigger, especially in the metro areas. The benefits are better. They've provided more benefits. So the good things are, number one, they do limit your out-of-pocket. So you remember, with original Medicare, there is no limit to your out-of-pocket cost. These plans limit your out-of-pocket, depending on the plan that you pick, somewhere between about $3,000 a year and about $7,500 a year. Okay, but that's annually. So January 1st, starts all over again. And they do still combine the drug coverage into one. Some of them don't, so you have to be careful. But most of them do combine the drug coverage. So you have your hospital, your medical, and your prescription coverage all in one. So it's convenient. And most of them do still provide extra benefits that Medicare doesn't cover, like dental and vision and hearing aids, maybe some money for over-the-counter things, transportation to a doctor's office. Some of them do still provide that free health club membership. So if you ever heard your friends talking about silver sneakers, that's what that is, okay? So that's the good parts of them. These are right for a couple of different types of people. The first one is the guy that comes into my office and he says, Ron, I haven't been to the doctor in 30 years and I don't plan on going back anytime soon. And I don't want to pay for one of those Medicare supplements. I'm just going to get that free HMO. It's not really free, but whatever. And I've got some money in the bank, so I don't mind taking my risk with that, taking my chances with that out-of-pocket cost. It's not going to change my life to write a $7,500 check. And I don't have a doctor. He died 20 years ago, so I don't care where I go if I do have to go. Okay? Well, Medicare Advantage might be right for that person. Another one is a person who just simply cannot afford any further monthly bills. Just can't afford it. And that's okay. Can't afford it, can't afford it. It's better than nothing. Don't get me wrong. It's 1,000% better than nothing. But because you can't afford anything else, you're going to be forced to take on some more risk for yourself, some more out-of-pocket risk. And you're going to be forced to give up some of your choices of doctors and hospitals. And you're going to be forced to give up a little bit of control with your healthcare decision making. And another person is a person who rather just kind of pay as you go. Instead of paying up front for a Medicare supplement and then nothing afterwards. These are more pay as you get sick. Okay? So you might pay 0 premium a month or $15 or $30 for a PPO, something like that. So it's a lot less than a Medicare supplement, but when you get sick, that's when you're paying. So it's a gamble either way. One side you're gambling that you're going to get sick. The other side you're gambling that you're not going to get sick. And the choice is up to you. Okay? So that's Medicare Advantage plans. Actually, these are 1-year contracts. So they have 1-year contracts with Medicare, 1-year contracts with the doctors, and 1-year contracts with you. If any one of those 3 things changes, well, now you may find yourself shopping for new insurance or shopping for a new doctor. And you can only change plans once a year during the annual enrollment period from October 15th to December 7th. They've got this new thing now called the open enrollment period from January 1st to March 31st. So let me explain the two very quickly. The normal annual enrollment period from October 15th to December 7th, you can change 25 times. One agent shows up at your house, you make him happy and sign up. Another agent calls you on the phone, you make him happy and sign up. It cancels that one out. And then finally what you got is what you got at December 7th. But maybe you made a mistake. Maybe you get down the road and you say, oh, you know what? There's this other doctor that I really need. I didn't remember, and he doesn't take the plan, so I want to change. So that period from January 1st to March 31st, called the open enrollment period, that's a one-time shot to fix any mistakes you made in the fall. Okay? So we've got a period basically from October 15th through the end of March that we can fix these things. But after March 31st, you're stuck for the rest of the year. Okay? That's Medicare Advantage plans. Any questions on those? Nope. All right. All right, so we've covered it all then. We talked about original Medicare, where you get all the choices, none of the out-of-pocket costs, none of the managed care hassles, or, yes, sir.
How often can you change a primary doctor?
So you can change it during the year, but you have to have an excuse.
You have to have an excuse?
Yeah, you have to have an excuse. You can't just go to a different doctor. In the case of an HMO. So with an
you got an HMO, but you don't like what he's doing for you. You want to change.
You have to call the insurance company up and make that change, and they have to approve it. Okay? I said you have to have an excuse. You have to tell them why. Right. Correct. Now, PPO, remember, you're not locked in. You can go wherever you want to. Yeah.
What about Medicare?
That's what Medicare Supplements. It's the same thing. Yeah, so that whole first part with the apples to apples, it's the same word. Medigap, Medicare Supplement, it's the same thing.
Why would somebody do a supplement when you can do a PPO?
Well, it's the same thing. So some people like that peace of mind knowing I'm just going to pay a monthly premium and then I don't ever have to worry about paying out-of-pocket cost. Some people, may not want to pay the monthly premium and just kind of take their chances.
Or like you say, pay as you go.
Pay as you go. Correct. Yep. And we don't care. As long as you understand which side you're getting into.
Yes, because with the PPO, the smaller premiums, you're still going to pay some out-of-pocket.
Yeah, it's kind of funny. With PPOs, you pay more to pay more. I don't really understand how the actuaries and the insurance companies design these products, but because it doesn't make sense to me. Because the PPOs have higher premiums, but they also have higher out-of-pocket costs usually. But what they do is they give you expanded networks and expanded extra benefits, things like that. Yeah. Was there one more question?
And if you work full-time and you have insurance through your work, come back with your
I'm going to cover that in just a minute.
Oh,
Yep.
thanks.
Got a big chunk of ice there.
Well,
Okay, so original Medicare, all the choices, none of the out-of-pocket costs, none of the managed care hassles, or Medicare Advantage where you pay less per month usually, but you might give up, in exchange for that lower monthly cost, you give up a little bit of choice in doctors and hospitals, you give up a little bit of choice in, you take on some extra out-of-pocket risk, and you give up a little bit of control with your healthcare decision making, okay? It's one or the other, folks. You can't have both. Okay? And it's very important that you make a wise decision, because once you make that choice, depending on your health and things, you might not be able to go back. Okay?
I have a question.
Sure.
So, pay the $148 a month and you're working full time and it still comes out of your paycheck. Why is that?
Because it's the government. Yep. That's the best answer I have for you. Yep.
Don't some people pay more for Medicare?
They do. If your income's very high, you pay more. That's the base premium, $148.50 a month. There's several tiers up above that based on your income 2 years ago. So they're always looking back 2 years. So if you're starting in 2021, they're going to be looking at your modified adjusted gross income in 2019. Yep. Okay. So what if you're still working and you, I'll answer her questions offline. What if you're still working and you have insurance from your employer or a retirement plan from your employer, or you're retired and you have a retirement plan from your employer? You've got some questions that you need answered. In some cases, I can answer those questions, like you work for civil service or the military or the state government, local government, or you work for one of the big companies around here there's a lot of retirees, like AT&T or whoever. In most other cases, we can't answer the questions, and the insurance company can't answer them either, so don't bother calling them. Call your human resources people, the benefits people at your company. Okay? And the questions are, number one, can I keep my insurance? Some companies say, yeah, nothing changes, you can keep your insurance. Some companies say, no, you're out. Some companies say, no, you're out, but we're going to give you some money to go buy your own insurance. Now, if your company says, no, you're out, well, you know what to do, come see us. If they say, yeah, you can keep your insurance, now you have two more questions. Number one, will you be required to have Medicare Part B? Remember, Medicare Part B is the one you pay for. Now, some companies have their insurance policies set up to where they will remain the primary payer and Medicare will be the secondary. If that's the case, then you probably don't have to have Medicare Part B and you don't need to pay for it. Some companies have their insurance set up to where they will revert to being the secondary and Medicare will be the primary. If that's the case, then you probably do have to have Medicare Part B and, of course, pay for it. Sometimes the easier way of asking that question is, who's going to be primary, Medicare or the company? That's the first question. The last one is, what's it going to cost me? Your premium can change. It can go up, it can go down, it can go away. Okay. Now, once you have that, once you have the answers to all those questions, then what do? You come see us. Because what we're going to do is we're going to compare them. We're going to say, what does your company insurance cost and what are the benefits versus what does my insurance cost and what are the benefits? We put them on paper side by side and just let the math speak for itself, and you just pick the one that's makes the most sense to you. You can just slide it open from that side over there if you want to go out. Okay. You just pick the one that makes the most sense to you. Does that sound good? All right. So I'll give you this when we're done. All right. So last little bit before we get started here with dinner, with lunch, is what are the benefits of working with us? So this is the last page in your book. Number one is we work for you. We're independent brokers. We represent all the major insurance companies that do business in Texas. They all pay us, and they all pay us about the same. They're very competitive that way. So it doesn't matter which one is right, which one you pick, as long as it's right for you. Okay? We owe allegiance to no one insurance company. Now we represent 40 plus, and we've got those narrowed down to our favorites of maybe 3 or 4. And there are favorites based on a couple of things. Number one, what's their track record? You know, can we see their history with what they've done with things like rate increases and claims paying time frames, things like that. And how do they treat you and how do they treat me? You know, if you need to call them, is the person on the other end of the line, are they in the United States? Do they speak English? Are they nice to you? Do they help? Those kinds of things, okay? So there's a lot of them. There's at least 40. We've got our favorites narrowed down to, you know, a handful. I said 3 or 4, but it's more like probably 6 or 7. And then out of those 7, we don't want to care which one you pick as long as it's the right fit for you. Okay? Next, personalized service. There are no cookie cutters in my office. When you come to see Erica, you come to see me, what's going to happen is we're going to sit down and we're going to have a good long talk about your health and about a few other things. And then we're going to make a good, suitable recommendation to you based on your specific needs. And the idea is everybody in this room could get a different recommendation because everybody in this room has a different situation. Next, I want you to think of us as your trusted advisor. I don't want you to have to pick up the phone and dial the 800 number for the insurance company just to wait on hold for 20 minutes and speak to somebody in some foreign country who does not care about you, who is just trying to hurry up and get you off the line to get to their next call to meet their quota for that day. That's fine, that's their job, but the fact is you don't have to do that. That's what we're here for. Okay? Next, every year,
I'm shutting it.
oh, you're shutting it. I'm sorry. I thought you were trying to open it. Didn't want you to feel stuck. All right. If your Medicare supplement rates went up too much for you, we'll just go shopping and find you another one. Anything else you want to talk about? Next, it's not just me. I own the company, but I've got a full-time staff. I've got agents here. Erica here is kind of the Medicare expert in the office, so she deals with most of the Medicare business. Now, I'm the money guy. I'm the licensed fiduciary. I'm the financial advisor, so our overall job is to protect your assets, and I handle your retirement accounts and 401ks, IRAs, those kinds of things. And then I've got another couple of experts that I work with. One would be my CPA. So we do your taxes for a very special price for my clients only. And we do that because you all have special tax concerns that younger people don't have. Like you may have medical costs or medical premiums that may or may not need to be deductible. You might have long-term care premiums or costs that may be deductible. Also, you've got 401k rollovers, IRA distributions, all those things have tax implications that younger people don't have. So he kind of specializes in folks like you as well. Also, my attorney, he specializes in estate planning. So we do your wills and trusts and powers of attorney and medical directives, all those documents for a very special price for my clients only. He specializes in estate planning, doesn't do personal injury or criminal defense, doesn't scream at you on television. You're never going to remember his phone number. We just do wills and probate. So, every so often we have a client appreciation event. We haven't had one in quite a while, just because, you know, it's not something that you do during COVID, apparently. But I think everybody's willing to come back out and come enjoy a dinner or wine and cheese hour or taco breakfast, just something. No kind of sales pitch involved. It's just me saying thank you. And then last but not least, you never pay 1 penny for my insurance services. So you may be thinking, Ron, if I buy insurance from you, I pay the premiums on that insurance and the insurance company pays you. So therefore, I'm paying you. That's fair. I'll accept that. But what you need to know is that you don't need to go through an agent to buy insurance. You can call any of these companies up directly and buy insurance directly from them. But the prices are regulated by the state of Texas and nobody can discount them. Not even the insurance company, not without permission from the state. So that means that you call the insurance company up direct, you pay the same price, but you don't get me. So now who's on that 800 number? That's you. And the fact is, I've got the secret 800 number, so I don't wait on hold anyway, but I'm not giving that to any of you people. That's all I have, folks. If you'd like to meet with me or Erica, in all honesty, it's probably going to be Erica because she's better at this stuff than I am. Just fill out this page. You already filled out the top section of it. If you've got your calendar here and you know you want to meet right away, just check off the boxes here that says something like, I want to meet with Erica next Tuesday at 10 o'clock. And we'll do our very best to make that happen. If you don't have your calendar with you, but you know you want to meet right away, check the next box that says, please call me right away to schedule an appointment. Betty or Erica will call you tomorrow and schedule that appointment. If your birthday is not until October and you don't want to think about it for a while, well, the next line is for you. Please call me 3 months before my birthday. Now, there's something very important to note here. One important note. Your Medicare benefits go into effect on the first day of your birthday month, not on your birthday. Okay? And the first day of your birthday month, not on your birthday. Unless your birthday's on the first, then it's the first day of the month before. And we know from experience that it takes about 12 weeks now from the time we submit an application, it's printed, it's processed, approved, printed, and mailed so that you have your insurance card in your hand ready to go when your benefits go into effect. So the very latest that you want to get started on this is about 3 months before your birthday. Now you can start much earlier, as early as 6 months before, but the very latest that you want to wait is about 3 months before. Okay? Folks, that's all I have. I really appreciate your time. Erica's going to come around and pick these up. I'm going to go out there, pay for the food so they'll actually bring it out this time. And we'll be right back. Thank you, folks.